More than 4 million people in the UK living with a long-term physical condition also suffer from mental health problems. A clinical consultant in Oxford says the conditions are linked.
We see people who have primarily anxiety, depression, mild, moderate, common mental health problems, because 1 in 4 people experience that. But we've also decided to focus on patients who have long-term medical conditions, because they're even up to 3 times more likely to have anxiety and depression. So that's part of why we're doing this. The other thing that we're wanting to do that's different is actually embed ourselves into physical health settings, working with patients when they're in clinic, at the hospital, so that we can work with their physical health professionals so they experience a sort of holistic approach to their medical care. So if you have a physical health problem, then that's really going to impact on your mental health. Some people feel quite anxious about their health, or they could feel quite depressed about it. And if you're feeling anxious, depressed and not very good, you're worrying a lot, that can then impact on how you manage your physical health condition. So you can get into a bit of a vicious cycle.
Dr. Heather Salt says some patients can experience anxiety as a result of dealing with a physical health condition.
Yeah, some people have already experienced anxiety, depression in the past, and sometimes when they get diagnosed with the condition, it can bring that back, and they haven't suffered from anxiety and depression for years, and suddenly it all re-emerges. So for some people, they've never had a problem, and it's the first time they experience a panic attack after they've got a physical health problem. So you can imagine if you've got a cardiac condition, it's quite scary, and you can worry that if your heart's beating fast, that might mean something's going to happen. But anxiety makes your heart beat fast too. So it's easy to get the symptoms confused.
The new service has also been set up to cope with the high volumes of patients using services at Talking Space Plus.
The general core service is different in terms of we're trying to make mental health care really accessible to the public. So we have a very high volume of people coming to use our services and trying to make it very accessible. Plus we use evidence-based treatments. For this long-term conditions work, that's quite fairly innovative in terms of the IAP services that Talking Space is part of. They haven't been offering it particularly to patients with long-term medical conditions, and certainly not embedded in their physical healthcare pathways and working with the doctors and the nurses.
The service offers talking and wellbeing activities to help patients manage their mental and physical health conditions. Kirstie Chambers, That's TV.